down.
The kickoff to Obamacare has been plagued with problems, users reporting long delays and an inability to create accounts. Now another wrinkle. Insurers say the program is putting out bad data, making it hard to deal with even the small number of people who have been able to create accounts. According to the Wall Street Journal, the errors range from mislabeling spouses as children to allowing clients to sign up for several different plans. Some insurers have had to hire workers to call up the new customers and verify their information.
Paul Howard is a Manhattan Institute Senior Fellow and Director of its Center for Medical Progress. He joins us now by Skype. Paul, the rollout in the healthcare exchanges online has been a complete disaster. Will the administration have to extend its deadline for the uninsured to buy policies while it sorts out these issues?
That all depends on how severe the problems are and how long they continue. The exchanges, the federal exchanges at least, have, as you said, been a bit of a rolling disaster so far. Now, people have until December to get coverage that begins January 1st, but the open enrollment period technically goes on through March. So they've got a couple of months to sort it out, but the longer it goes, the worse it's going to get. We've already seen, according to some sources, interest in the exchanges dropped by 88% since October 1st. So they've got a few more weeks at least to try and get things fixed. But if they don't, they could create a lot more headaches for themselves down the road.
Some people are reporting steep increases in their premiums and high deductibles, yet the administration promised this would reduce the cost. So what's going on?
What's going on is the administration is asking people to buy richer coverage than they had before. So if you're a 27-year-old man or a 53-year-old woman, you have to buy maternity care whether or not you expect to have a child. The 10 basic categories of care that are covered under quote-unquote essential health benefits include things like drug addiction services, hospital care, prescription drugs. This all raises the basic cost of coverage. So if you have coverage in the individual market today, and you've got, for instance, a high deductible policy or more of a bare bones policy, you're going to pay more for coverage under the president's plan.
Now, one of your colleagues at the Manhattan Institute wrote in Forbes that one reason the website is breaking down is because it's designed to hide higher costs by factoring in government subsidies. What do you say to that?
The subsidies don't make the insurance cheap. They just make it look cheap to the person who's buying it. So you've got a plan that costs $6,000 or $7,000 or $10,000, and you throw in $9,500 worth of taxpayer subsidies. Suddenly it looks cheap. But if you see the actual price of the plan, you see that costs have gone up. And the truth of it is that half of all the uninsured, at least, are probably not going to qualify for any significant subsidies to offset those costs. So the administration wanted to blunt that edge and try and show people the carrot of subsidies before they saw the sticker price.
Now, won't the government subsidies actually increase inequality in health care coverage?
Well, we're creating another layer of subsidy. So right now you get a subsidy through the tax code. If you have employer-provided health insurance, your employer funnels that subsidy to you. So if you don't work for an employer that offers health insurance, you don't get the subsidy. So that creates inequality. And the subsidies for some low-income people on the exchanges are actually more generous than employer-provided coverage. So it creates, a set of people with the exact same income. If one of them works for an employer who offers coverage, they get less of a subsidy than somebody who works at an employer that doesn't offer coverage. And so they would get not only the tax subsidy through the exchanges, they could also get a wage increase. So it does create yet more inequality in the healthcare marketplace.
All right, Paul Howard of the Manhattan Institute, thank you so much for your time.
My pleasure. Thank you.